Okay, hello everyone. My name is Esteban Ayala, and I'm going to explain today the free drug injection facilities in Canada. So, these facilities, also known as supervised consumption sites, are specialized um, uh, healthcare services that provide a safe, sterile environment for individuals that use drugs. During this presentation, um, we will explore various aspects of free drugs injection facilities. We will explore the opioid crisis in Canada, the harm reduction approach, the legal framework and operational mode that and services offered, and the future of free drugs injection facilities. Okay, so as a thesis, free drugs injections facilities in Canada play a vital role in reducing the harms associated with illicit drugs use, improving public health and safety, and connecting individuals to essential health and social services. So, understanding the opioid crisis in Canada, we know like there's has been a widespread addiction. So Canada has experienced a devastating opioid epidemic with skyrocketing overdose deaths and millions struggling with substance use disorder. So we know there's also a potent synthetic opioids. And illicit, one of these is like the illicit fentanyl, and other high potent synthetic opiates have polluted the drug supply, making opiate use far more dangerous. And the socioeconomic factors such as poverty, mental health issues, and lack of access to treatment have contributed to the crisis, impacting way more to marginalized communities. So, harm reduction approaches to substance use. This harm reduction approach is the main approach these facilities use to treat drug users. So, what this about is they try to minimize the negative consequence of of a sustained use rather than abstinence only approaches. The goal is to empower individuals to make informed choices and access resources to improve their health and well-being. Harm reduction strategies include safe injection sites, naloxone and distribution, and drugs testing services to reduce the risk of overdose and disease transmission. Objectives. These facilities have three main objectives. Of course, the first one is trying to reduce overdose deaths. Um, they they can do this providing a safe, supervised environment where people can use pre-obtained drugs under the care of medical professionals trained to respond to overdose. The second one is to improve public health, offering access to sterile injection equipment, addiction treatment, referrals, and other health services to reduce the spread of infection diseases. The third one, and actually I think is really important too, is building a community trust, foresting a non-judgmental space that connects marginalized individuals with social services and helps destigmatize substance use disorders. So they also have a legal framework and regulations. It's a really organized institution. So Canada has a well-defined legal framework for the operational free drugs injection facilities, even though there's some people who are not agreeing with this, but we will talk about that later. These facilities fall under health and harm reduction policies with specific regulations governing their setups, staffings, and services. Operational mode, sorry, and service offered. Free drugs injection facilities in Canada follow a harm reduction model, as we already explained, and are staffed by trained healthcare professionals who can intervene in the event of an overdose and provide basic medical care. They also offer education on safer injections practices and disruptions of naloxone kits to reverse opioid overdose. So the impact on public health and safety, we have four important points. The first one is free drug injection facilities have been shown to significantly reduce overdose rates and fatalities by providing a safe, supervised environment for drugs used and access to naloxone. The second one, by establishing a trust and providing access to services, free drugs injection facilities can connect more people and addiction treatment and other social support programs. The third one is that these facilities help reduce the improper disposal of drugs paraphernalia, such as needles, in public spaces, providing such overall community cleanliness and safety. And the fourth one is the access to sterile equipment and education to safe injection practices, helping to curb the spread of infection diseases like HIV and hepatitis C among other people who use this kind of drug. So this is what I was talking about, the people not agreeing with these facilities. Challenges and criticisms. Legal ambiguity. The legal status of free drugs injection facilities remains in a gray area, with some people arguing that they are enabling illegal drugs being used on our society in a legal way. However, others are seeing them as a good way to a harm reduction approach. Community concerns. Some local communities have expressed concerns about the facilities attracting those drugs users and potentially increasing crime on public disorder in the area. Stigma and misconceptions. This is why I was saying is important creating a trusting community, because there's a lot of stigma and misunderstanding around addiction and harm reduction strategies, which can make it difficult to gather public support or for these facilities. Funding and resources. This also is a big problem. Since establishing and operating free drugs injection facilities require substantial funding and resources, which can be a big challenge for a cash-strapped healthcare system. Success and lessons learned. We will see that these facilities have proven effectiveness, demonstrating their ability to reduce overdose deaths, connect people to treatment, and improve public health outcomes in sites like Vancouver and Montreal. There's also a lot of collaborative partnerships. These partnerships between health services, law enforcement, and community organizations have been key to the success of these facilities, ensuring a holistic approach to harm reduction. Finally, a continuous improvement. These facilities have learned a lot during this past 20 years and have led to refinements in the facility design, staff training, and service delivery, making these programs more effective and responsive to the needs of people who use drugs. Finally, the future of free drugs injection facilities in Canada. As you can see in the right, we can see a chart of the number of deaths by overdose in Vancouver and in the rest of Columbia. And as you can see, in the past 20 years, the number of deaths in Vancouver have been going lower and lower, more than the rest of British Columbia, right? So as the opioid crisis continues to devastate communities, the future of free drugs injection facilities in Canada holds promise. Voicemakers are exploring to expanding this harm reduction program to more cities, providing a lifeline to those struggling with addiction without going to board and data-driven improvements. These facilities can save lives and guide more individuals towards recovery. So in conclusion, free drugs injection facilities in Canada play a crucial role in addressing the opioid crisis and reducing the harms associated with illicit drug use, supervised by training staff, on offering essential health and social services, connecting individuals with resources for addiction treatment, and support the harm reduction approach embraced by these facilities, recognize the complex nature of substance use, and aims to minimize their negative consequences without judgment or stigma. Reference, and thank you so much.